Primary exertional headache. Headache is a complaint. It's not a disease. So I can name at least some 200 to 300 conditions where headache will be the one of the complaints of the patient. So here I'd like to tell you about primary exertional headache. That means that whenever the person exerts beyond his physical limit, it results in headache. So I have mentioned primary because this type of headache, you have two types. It can be primary or it can be secondary. Secondary means the patient already has got some problem in his body, say like migraine or maybe stress induced. He is already a type A personality, a lot of strain and stress and strain, or he is hypertensive, not well under controlled, and like that. So he already has some problem. So whenever he does little bit of exertion that is beyond his limit, he gets headache immediately. That is secondary exertional headache. So this topic I am going to talk mainly about the primary one, where you don't have any cause at all. This is commonly seen in young persons, and the headache, it increases, gets aggravated if suppose the outside temperature is high and humidity is less. That can precipitate the headache very fast. So whenever we take a history of the patient, from the patient, he may not be suffering from migraine, but he may give a family history of migraine, such type of patients. So why does he get physical, whenever he does physical exertion, why does he get headache? What happens is, whenever he does physical exertion, which is beyond his limit, he is overdoing it. Whenever he does that, the blood supply to the muscles of the head and scalp increases. When that happens because when it happens, the blood vessels supplying the muscle, it has to dilate to supply more of blood. So whenever it dilates, when the blood vessels dilate, it releases chemicals which results in headache. That's how this happens. So complaint of the patient will be headache during exertion. So when we do an ENT examination, even to start with the vitals, everything, all the examinations will be normal. Why we are doing the examination and the investigation is to rule out any secondary causes there or not, so that we can give importance to that and treat the condition. Here I am going to tell you about the primary exertional headache. So the first thing I want to tell you is, this is a self-limiting condition. So if you can avoid the over-exertion, you can avoid the headache. So you should know the limit of your exertion, whether it is a normal work or it is exercise. So now to prevent this or to treat, we have it's the same medication. Indomethacin is a good medicine which can be used as prevention, or it can be used as treatment also. But usually this medication, which comes in 25 milligrams and long acting one is 75 milligrams, we don't prescribe in asthma patients, means wheezing and breathing difficulty patients related to allergy. And we don't prescribe in those suffering from acidity and those patients who are suffering from kidney related problems. But always it's better that whenever you take any medication, instead of buying over the counter in the pharmacy, it is better that you consult your doctor and then take the medication. And not only the medication, I want to tell you a few more things. It's always better that you hydrate yourself well. And normal person, we need 2 liters of water per day. Since you are doing over exertion, you need more than 2 liters, 2.5 to 3 liters. Not only that, if suppose the exertion, it is exercise. So if it is exercise, then it is always better before the exercise you warm up a little bit. And after the exercise, if you want to drink something, you add some electrolytes also. So that also can help you much. So that is how we treat primary exertional headache. Thank you so much.